Hello, everyone. Thank you for coming. Welcome to NAUTO's 39th Annual Conference. We will be starting in about 1 minute. Before we begin, we want to cover a few housekeeping items. On your attendee screen, you can enter comments or questions in the chat. We hope you will take advantage of the opportunity to engage with our speakers and other attendees. This session is being recorded. We recognize and thank the California Healthcare Foundation for being our Petabyte sponsor. Information about all conference sponsors is available in the sponsor area of the platform. Please take a few minutes to visit each sponsor's booth where you can find information about them and find game tokens. Game tokens are keywords or phrases used in the token hunt game for a chance to win a prize in the daily drawings. Now, let me turn the stage over to Charles Hawley, NAUTO's Director of Projects. Charles, the stage is yours.
Thank you, Erica, and welcome everyone. I hope you all enjoyed the networking sessions. I certainly had a good time myself talking about data standards, one of my favorites. I'm excited to start this session and invite all of you in to enjoy this conversation on data gaps and linkage, using linkage to overcome data gaps. Let me go ahead and introduce and bring to the stage Jonathan Mathieu with Freedman Healthcare, who is this session's moderator and organizer. Oh, Jonathan, there you go. I'll take that down. I'll turn the stage over to you, Jonathan.
Thank you, Charles, and thank you everyone for joining us today. This is Governance and Privacy Operational Issues for Health Data Programs. We've got 3 very interesting presentations coming up to provide some perspective on operational issues related to data governance and policy. By virtue of our work, we're all very familiar with data privacy laws and regulations, both at the federal and the state level. We all share a solemn responsibility to protect patient privacy and data security, which is absolutely essential to building trust and support for the work that we all do. While statute and regulations that enable what we do provide requirements and guardrails around what we can do, how the data can be used, and for what, and by whom, where the rubber really hits the road, so to speak, is that we have to create policies and procedures to operationalize those statutory and regulatory requirements. Something that we see in the APCD world, which now includes a little more than half of states, are different levels of tolerance for risk. Some APCDs make de-identified data available and avoid some of the PHI and privacy-related issues. Many others make limited data sets available, and some also provide research identifiable files or identifiable data through a data request process, review and approval process, and so forth. But all data release and access, regardless of the level of PHI or other types of sensitive information, require that we develop policies and procedures. And our panelists today will talk about processes and frameworks for making data available for access and release to people who can use it to generate information that informs policy and helps us all make better informed decisions. So you'll hear in these next presentations information on different approaches to engaging stakeholders, developing policies and procedures, and making data available to those who can use it to make a meaningful difference. And with that, I think we're ready for the first presentation.
Hi, thanks for joining our session today. We're talking about empowering teams with custom data analytics training, a collaborative success. My name's Jen Wells, and I'm an account director at Futurety. I've been in the digital marketing and data analytics space for the last 20 years, working in a variety of different capacities. I owned a staffing and placement firm focused on building and growing marketing and technology teams, and I also built a hands-on digital analytics training program geared towards those that were not looking to go to college, that wanted a career in data analytics, or those that were interested in a career in data analytics but already had a full-time job. Over the course of this past year here at Futurety, we've been working on building and refining client training for data analytics, and that's what we're going to talk about here today. So we really focused on how we were building for the future. And so we had to ask ourselves, how do we get back to the basics? How do we make data more accessible for our teams? How do we manage dashboards and ensure accuracy across those dashboards in our reporting? How do we ensure our teams are aligned in their interpretation of the key metrics and the insights? And how do we educate our teams to think critically and use the tools that we already have in place? And so as we started asking ourselves those questions, we kept going back to the basics. And maybe you've heard this quote before, but with good basics, you'll have endless options. So when you think about fashion, you have your staples in your wardrobe, you have a black blazer or a particular color of pants and plain colored shirts, things that can be mixed and matched for different occasions. And so this isn't all that different. I coach my daughter's soccer team, and there are 14 girls on her team this year. And of those 14 girls, only 3 of the girls are girls we've had in previous years. The other girls on the team, 11 of them, many of them have never played soccer before. So we had to go back to the basics. We had to start talking about how do we even kick a ball? What are the positions on the field? What are different plays? How do we throw a ball in? What are the rules of the game? And so we had to go back to the basics. But by going back to the basics, it's given us so many different ways that we can now play in our games, because girls can play in different positions, and we do have different strategies on the field that we are able to use that we wouldn't had we not gone back to these basics. So let's talk about how we structured our training and how we use that to maximize impact and relevance. So we really focused on this tell, show, do type of mentality. So what we mean by that is we would first tell the teams or explain to them what we were asking them to do. We would then show them, and then we would ask them to do it. In doing so, we're really addressing a number of challenges across the team. We have quickly growing teams. Of these growing teams, there are varying levels of experiences and exposure to analytics across these teams. There's been a lack of clarity around the tools and dashboards that are being used. And because of all of this, the analytics teams and analysts are being asked question after question and backing the teams up from the standpoint of bottlenecks, because they're overloaded with the questions and the tasks that they are being asked to manage and do on a daily basis. So this all goes with the quote that many of you have probably heard: give a man a fish, he will eat today, but teach a man to fish and he will eat forever. So we're really helping the teams build the confidence and the skills to do these types of things on their own without always having to ask for help. So we started by leveling the playing field. The training sessions were kind of built on 2 main, paths, if you will. So we had the focus of the strategy and the traditional slides. So we would use and focus on concepts like the 5 whys, the leading and lagging indicators. We taught the teams how to do storytelling with data. Once we would get through those traditional slides and the concepts, we would then focus on the real world examples. So these hands-on examples would help answer the questions such as, how do we find the click-through rate of an email campaign? We would first explain it to them and show them, and then we would ask them to do the same. How do we identify exit pages on our dashboards? We would explain it, we would show them, and then we would ask them to do the same. So we utilized regular planning sessions. So these planning sessions were used as an opportunity for everyone to come together and talk about what was going on in the meeting that they had last week, or what kinds of questions they got earlier in the week. So this was an opportunity for everyone to regroup on what was happening and where we really needed to focus from one week to the next on our trainings. Some examples of some of the concepts that we taught and how we did it. So this is the 5 whys here. So we would walk through this with the team in multiple sessions. We didn't just teach these concepts in just one session. We really wanted to ensure that the information stuck and folks learned it so that they were able to use this on an ongoing basis themselves. So for the 5 whys, we would ask a question such as, the team missed the deadline for running executive reports. Why? Well, no one was on site to run the reports. Why? Well, because the person who regularly ran the reports was on vacation, so no one was on site to do the job. Why? Well, there was no backup in place for that activity. Why? No one was identified as the backup to run the reports, right? It's kind of like talking to your 3-year-old. We keep asking the question why until we get to that root cause. And if we can ask up to 5 whys, we're usually able to get pretty close to that root cause, sometimes maybe even sooner. So that was just kind of an example of one of the concepts that we used in this training, but you can think about how that might apply to what you're doing and what you might think about doing with your teams. The other big piece of it really was engaging individuals on these teams, so promoting active team participation. So we regularly asked for employee feedback. Without that employee feedback, it makes it very difficult for us to ensure that the employees are getting the most out of this training and that it is training that they can take back and use in their day-to-day work. In addition to that employee feedback, we were also asking for management feedback. So we had an ongoing feedback loop with the management team. They were invited to our regular planning meetings. We had we regularly have other touch bases and communications with them. So regular email communications that are going back and forth because, again, that feedback is the backbone of what we're doing. If we don't get that feedback, it's really difficult for us to make sure that we're staying as relevant as we can from one training session to the next. And as expected, there's iterations of that training. Based on that feedback, we're able to continue iterating on that training and make sure from one training to the next, it's the most helpful, most relevant training that it can be. We involve everyone. The newest team members can add value and tenured employees can add value. New team members often ask questions that tenured employees don't even think of because they have a different lens to view it from. Those tenured employees have historical knowledge that newer team members don't. So by engaging both the new team members as well as the tenured employees, it's an opportunity for individuals across the teams to see different perspectives and hear different questions. We ask the participants questions directly. We have the managers asking their team members questions during these trainings. We're very specific. We've learned that the more specific we are about the training and examples we use, the better it's received, and folks are able to then take that on and use it in their day-to-day work. We get hands-on. We ask folks to do things through the tell, show, and do method. And as we talk about driving adoption, it's this integration of these data-driven strategies in real-world scenarios on a day-to-day basis. So this teamwork aspect is really important. We talked about the tell, show, and do. We use practical everyday work examples like we talked about. And this is only possible because we have the feedback from the managers and from the employees on these teams. We incorporate the adoption into the training. So we're working in the platforms that they're using on a regular basis. We're working in the reporting that they're using on a regular basis. We have this leadership buy-in, and there's clear communication across teams. All of these pieces work together to ensure that the training is successful, and so is the adoption of this training. Thank you so much for listening. Look forward to any questions you might have.
Thank you for that presentation, Jen. That was very, very helpful. Given our audience, I'm wondering if you could say a little bit about your unique experience working with groups in the healthcare space, the type of data, the kind of unique challenges that arise in facilitating this work with a healthcare audience.
Yeah. So I think probably something that's very unique, at least with this particular client, is we're specifically working with healthcare data. So as everyone knows now, the HIPAA compliance and online data and what we're able to track and what we're not able to track provides challenges of its own. And there's certainly not quite a one size fits all answer to it. So a lot of our challenges and questions are around how do we get the data that we need, because a lot of this is marketing data, right? And how can we then apply that to the marketing campaigns that we're doing? So I can't sit here and say I have all the answers. We work very closely with our legal teams. We have internal HIPAA experts as well that are able to guide us on that. But those are all conversations and questions we have to take very seriously to ensure we're not, crossing over any lines we don't want to be crossing over.
Great, thank you. And we do have one question from the audience.
Yeah.
What tools or software applications did you use for the tell, show, and do training? I'm guessing Tableau for visualizations.
So actually, this particular client is using Datorama and Looker Studio. We use Looker Studio for a lot of ad hoc reporting. We are in the process of transitioning things over into Tableau. So that will actually lead into some trainings that we will be doing this upcoming year. So yeah.
And creating quick follow-up from me, creating Tableau reports is something that you provide or advise on with your clients?
Correct, both.
Great. I don't see any other questions in the chat at the moment. Any sort of final comments you'd like to make?
Yeah, I think, around the training, the biggest thing for all teams is just enablement. These teams have so many different platforms and so many different tools that they're using. Ensuring that you're continuing to train on these tools and provide those real world examples so that they can go in and use these tools on a regular basis is really important, and getting the value out of the tools that your teams have invested in.
Great. Thank you very much.
Yeah.
We'll look forward to other audience questions that we'll answer at the end.
Sounds great. Thanks.
Thank you. Our next presenters are from HSRI, the Human Services Research Institute, Monica Cañizares and Leanne Candura.
Good afternoon and welcome to our presentation on data access permitted by APCDs. My name is Monica Cañizares. I'm a research assistant at Human Services Research Institute, or HSRI, and I'm here with one of our vice presidents and director of the population health team, Leanne Candura. Before we begin, HSRI would like to acknowledge one of our clients, the Minnesota Department of Health. The information being presented today is based in part on our work conducted in our partnership with the state of Minnesota and expanding access to their APCD. HSRI is a nonprofit mission-driven institute that provides services to improve health and human service systems. Our population health team has been implementing state APCDs since 2012 and has supported the creation and implementation of data standards since. Today we're reviewing data release policies. State APCDs have worked to harmonize across standards of data collection processes, but data release is a different story. Legislation from each state shapes how APCD data are releasable beyond the state agency, if data are releasable at all. Many states have broad language that reference APCD data being releasable for projects that will contribute to overall population health or the public good. So today we'll review the scope of our scan, what different variations there are, and what are the implications of this. HSRI compared the data release policies, application materials, and fee schedules of 14 states with public release processes. These are not all the states with the current public release process. We included states if they had their data request application or data use agreement available for download on their website. Before diving into non-public data, it is notable that some APCDs release APCD data publicly online. Most frequently, this was through a curated data dashboard, but there were some states that had public data sets that were available for download or request forms to access those public data sets. When looking at data release, the type of user can influence what kind of data elements or release format is available. There's many different users that are described in data applications, but the type of user most frequently, not surprisingly, were researchers or state agencies that were described in application materials or fee schedules. There were some discrepancy in language used that potentially could describe overlapping categories across states. For example, the redistributor or reseller category was used by 3 states as a separate category, whereas in other states this might fall under for-profit entity or other entity. This distinction comes into play when it comes to restrictions on users and data access. For example, one state, this was related to the availability of identifiers in the data. One state said that anyone outside of the state agency would only be eligible for a de-identified data set. So there was a category of state agency and other agencies when it came to identifiers in the data. There's also financial implications. When reviewing fee schedules, states use many variables to format their fee schedule, but the user type was most frequently one part of the fee structure. So one type of user would pay more or less for data than a different type of user. Finally, there's also process differences depending on the type of requester and agreements that might be available to them from the APCD. When looking at data use agreements themselves, data use agreements always addressed the permitted use of data. And more often than not, this was simply the permitted use of data is that described in the application materials. So either in the data use agreement or in the data request application, there would be a specific project, and that was the extent that data was being permitted to use was in that project description. The data use agreement and data application are a pair of documents used together to create data security structure and safeguards. On the bottom left here, regarding data security information, 10 states had data use agreements available for us to review. Of those, 6 states addressed data security in their data use agreement, and 4 states addressed it in application materials. The difference here is really just related to how a state wants to structure the specificity of information regarding data security. For example, in one state data use agreement, users state that they will ensure that all data are stored and accessed only in areas that are always physically safe from access by unauthorized persons. That was the extent that physical safeguards were addressed in the data use agreement. Versus in a data application, there may be an open-ended question. What are your physical safeguards? So listing out those actual locking mechanisms or login procedures, or they may have several open-ended questions about physical safeguards. These are just options that states consider when forming their data security structure and how specific they want to be. Open-ended questions may elicit more details from a data requester, but without further documentation explaining requirements or expectations, the expectations on data security may not be very transparent. Versus a data use agreement lists specific elements that a requester agrees to. Other elements in a data use agreement at the top right, linkage plans were either requested or restricted in 4 data use agreements. 4 data use agreements addressed inspections of physical safeguards. And while all data use agreements stated that reporting of data breaches were required, 3 states also required ongoing or regular reporting about the progress of a data application project and time frame or what kind of steps are next in the process from the data user. Finally, looking at data ownership, as I mentioned, the use of data was restricted to that listed in the application. So data ownership was mentioned in that context, but it was also related to citing the state or the APCD as the owner of data when data was disseminated. And this was addressed in 8 states' data use agreements. There are many steps related in accessing APCD data, and here are 4 that are related to data security. So 12 states of the 14 we reviewed had a data review committee that looked at applications. 2 of these states, it was only for certain requests, and 10 states did not specify what kind of requests. The public display of data request applications occurred in a little over half the states. For 3 of these states, it was also available for public comment on a data application, which was often with applications that requested the inclusion of PHI. Other publication of request involved just posting the request online after it is approved or the ongoing active applications. 8 states required a review of all outputs pre-dissemination outside of the project team, and 3 other states had a different review process or just asked for a data dissemination plan. And finally, data destruction was required by most states or listed in their data use agreement. 10 states had a specific data destruction form that they provided, and other states either just asked for the destruction plan or had a different written certification. So finally, what are the implications? These are just process elements or options that can either create barriers or facilitate partnerships with the community, with researchers, nonprofits, and other organizations that might partner with the state APCD to advance health and data equity. Being able to understand these processes, how transparent they are, as well as understanding the infrastructure of requesters and at what points might be a barrier for certain entities can help states either reframe their structure to be more inclusive or more restrictive if there are security concerns. Costs, as we're aware, it's expensive to request APCD data. There's paperwork and application fees for a lot of states just to request the data. So 2 states asked data requesters about their funding information in their data request applications, and other states, either in their scholarship or fee waiver information, asked about organizational and project funding. 1 year of a standard release data set is at least $3,000 in almost all states we reviewed, even for researchers and government entities. That's at the low end. So if states have a mandate to not create a barrier in access to APCD data, costs are a consideration here. Finally, cross-state compatibility and interoperability. Depending on the state, data requester may have different security requirements, the data may be released in a different format, or they may not have access to all the same elements across states. So a researcher that wants to do a cross-state comparison will have different procedures or different data released to them depending on the permission set by the state. That's one other consideration. So thank you. These are the states we included in our scan, and I hope we can answer any questions that may have emerged.
Great. Thank you very much for the presentation. And just a quick reminder to the audience to please submit your questions for consideration now or at the end. And you just got a pop-up reminder as well. So please submit those questions that you have in the chat. I have a couple that I'd like to ask. High-level question, in this review, which is very comprehensive and very helpful, was there anything surprising? Did anything really jump out at either of you that maybe you didn't expect or weren't already familiar with?
Thanks, Jonathan. I think just noting that how permitted uses oftentimes were just relayed to what was described in the application. There were some restrictions later on, but that data requesters really were the ones filling in there what they're using data for, and then that might have legislative implications from the state, but from a documentation perspective, that it wasn't always explicit. And then I think just noting differences about like a couple states having regular reporting required from data users. That was just an interesting interaction from the state to the data requester. And then the transparency that was involved with having full applications posted online. Those are just 3 interesting variables that I found in this process.
Great. Go ahead, Leanne.
I was just going to add to it, and I think Monica touched on this at the end of the presentation as well. Just how different each state's approach was in this process, and just thinking about having being a data requester as well, and thinking about trying to access data from multiple states, the challenges with trying to understand the differences in processes.
Great, thank you. We do have an audience question. How feasible is it for APCD personnel or other agency to follow up on the DUA and ensure compliance? I realize this is a policy review, but in your experience, have you observed how APCDs are able to follow up?
Oh, great question. I think a lot of it depends on staffing at a particular state. I think at least an annual audit is what I'm most familiar with, where states will go back and see who has outstanding data requests, has the period closed in which they said their study was going to be complete, have they received the results. I think the more standard some of the processes are in ensuring, in that example, that if there was supposed to be an end date and that was shared, ensuring the project was done, especially if results haven't been shared. But it is a challenge. As we know, most state agencies, especially for APCDs, they aren't well funded, and so being able to have a robust compliance process is certainly desired. But I think there are challenges there, and that's been our experience.
Yeah, absolutely. I think it's important to note too that once a data use agreement is signed, it's a binding contract. And there are enforcement opportunities. I've never seen them exercised, either in Colorado or in other states in which I've worked. But starting with the Office of Civil Rights at HHS, all the way down to state attorneys general, and even criminal and civil action. So the DUA, just to remind everybody, is a binding contract, and it's an important part of the overall package, even where states may have modest resources for enforcement purposes.
Yes, it is relied on heavily.
Yep. And like I said, I haven't, in my 12 years in the APCD world, I've never run into anybody naughty. So that's always a nice thing. One quick thought. How many states share full applications? I know there's a lot of variation there. If you could say just a little bit more about that.
Sure. I think we had 3 states that had their full applications online, and some of those it was pending, so for public comment on those, and then some of those it was only the approved application. So there was variation there, but I think there were a few states that had a full application online.
Terrific, thank you. And with that, we'll go to our last presenter. I'll save other questions for the general Q&A at the end, but let's hear from Katherine Lockett.
Hello, everyone. I am Katherine Lockett, the Data Governance and Quality Lead for North Carolina Department of Health and Human Services. I am so excited to be here with you guys today to share how we at North Carolina Department of Health and Human Services have been transforming our approach to data governance. Our goal is really clear. It is to elevate data to the status of a first-class citizen, optimizing its potential to improve public health services across North Carolina. So we'll start by kind of talking about our foundation a little, our journey. We'll dive into some of our organizational structure. We'll discuss some of our core frameworks, and then we'll wrap up with how all of this comes together to enhance our operations and our strategic initiatives. So let's start by looking at our journey. We began in 2019 when we established the data office. We were tasked with a mighty goal, which was to drive a department-wide transformation by treating data as a strategic business asset akin to a first-class citizen within our operations. The vision was quickly put to the test and accelerated through our response to the COVID-19 pandemic, showcasing our capabilities and the critical need for robust data governance. So now let's kind of look at our journey a little bit more. So we started by developing a comprehensive data strategy that was based on 5 key pillars. We collaborated with Actionable Intelligence for Social Policy to develop our data sharing and our legal frameworks. We also launched a business intelligence platform. We created a data sharing guidebook and our legal framework, setting a really solid foundation for data governance. So speaking of data governance, let me talk about our data governance structure a little bit. At the top is the Data Governance Executive Board. This is our voting body that makes key policy and resource decisions. They are supported by the Data Governance Council, which is ensuring alignment of data initiatives with the organizational goals. We have a data stewards community that focuses on operational aspects of data management and quality. And then we have ad hoc groups that are formed based on specific data needs to address emerging challenges and special projects. Now, let's look a little bit more at our framework, right? It is structured around these 5 key pillars. And this is designed to enable us to be able to use data in actionable ways across our department. This framework incorporates these essential tools such as our legal framework, our data sharing guidebook, and our data asset inventory. Each of these tools is important to supporting our overall data strategy and ensuring that we can operate efficiently and effectively. These components ensure that data is used again in actionable ways. So let's take a deeper dive into these. Let's start with our legal framework. Our data governance is supported by 3 foundational legal agreements that ensure compliance and facilitate effective data management across our department. These are our interdepartmental MOU, our data sharing agreements, and our data use agreements. Our interdepartmental memorandum of understanding acts as this overarching document that sets the guiding principles for data collaboration. It also ensures that all divisions and offices follow unified standards for access and use. We also have a data sharing agreement. The data sharing agreement specifies the terms for how data is managed and shared within specific divisions, reinforcing the standards set by the IMOU and ensuring division-specific requirements are met. And then finally, we have a data use agreement. The data use agreements are executed for specific data requests to define the responsibilities of data recipients. And they cover how data will be handled and used within a project. So summing this part up, together these agreements form a robust legal framework that underpins our data governance, ensuring that data is used responsibly and effectively at all levels across North Carolina Department of Health and Human Services. Now, let's look at our data asset inventory. This is a key tool in our data governance arsenal at DHHS. This data asset inventory is designed to catalog all of our significant data assets within the department. And it includes metadata such as where is this data stored? What's the repository? Who manages it? So it includes the data owners, the data stewards, and the data custodians. And it provides a description of the data. And all of this is accessible through a user-friendly, searchable dashboard. The purpose of this inventory is to do a couple things. One is to enhance transparency and accessibility, which enables our staff to easily locate and utilize data for informed decision making. It supports the guidelines that are set forth in our data sharing guidebook, which I'll cover next, by streamlining the data request process, ensuring that each request aligns with our governance and our policies and data protection standards. And this is updated routinely to reflect any updates or changes. So now let's look at our and talk about our data sharing guidebook a little bit. This is a publicly available resource that outlines the processes and protocols for sharing and accessing data within our department. It's designed to clarify roles and responsibilities and the steps that are required for both requesting and sharing data effectively. The guidebook serves as a roadmap, reducing the administrative burden on staff by providing this clear, actionable guideline on how to handle data requests. It also includes everything from operational to research-based requests, ensuring that all data sharing aligns with our legal and our ethical standards. Additionally, the guidebook includes specific topics such as data de-identification, transfer procedures, and storage solutions, which are important for maintaining that data privacy and security. So by standardizing these processes, the data sharing guidebook helps us achieve greater efficiency and consistency in our data management practices. Ultimately, this guidebook is instrumental in fostering a culture of data-driven decision-making, empowering our staff to use data responsibly and effectively to enhance the health services that we provide to the residents of North Carolina. So really, it simplifies the process, and who doesn't like simple? And in closing, our data governance efforts transform data into a strategic asset that truly empowers us to better serve the people of North Carolina. Our approach aligns with national goals like this organization to leverage health data for better decision making and improved healthcare services. Thank you so much for your attention, and I'm happy to answer any questions you might have.
Thank you, Katherine. That was a terrific presentation. Donald Poe from Arkansas mentions in response to the last presentation that Arkansas has a data destruction portion in their DUA for the data requester. He also reminds us that they do give extensions, but the data does have a finite lifespan. I think that's an important provision of data use agreements, data sharing agreements, to highlight for the audience who may not be familiar with that. And Ryan Christensen agrees that simple is good. Couple of quick questions. You've built a very comprehensive system from your descriptions, and it seems very helpful documentation. And those of us who have been attending NATO meetings for years know that documentation is a theme that shows up in a lot of different presentations. I'm curious, given how much thought and work has gone into developing these processes in North Carolina, what do you do next, or what's still on the to-do list?
So what do we do next? That's a great question. One, we always want to kind of evaluate that process and see how it's working. So example, over this past year, we've done some updates to our data sharing guidebook, expanding the descriptions for the roles, trying to enhance our data asset inventory dashboard to include some data dictionaries so that data requesters better understand what's in those specific data sets to kind of streamline that process. So those are a couple of the things that we're working on to try to make that process even better.
Terrific. I was especially interested in your description of the data asset inventory. That is almost always a difficult fundamental question. Where do I find what I need? And can you talk a little bit about what data sources are reflected in that inventory?
So what we do here is kind of go to the divisions and say, what are your critical assets? What are the data that people are requesting often? What are you using to kind of gain insights, right? And so we go to each division's data owner and we get them to catalog that. And so when they do that, we put that in a public facing intranet for, our division. So it's not external like the last presenter talked about, but it is easy for our department to be able to access that. And so we just do this annually, and we've created a culture where they already understand what the annual expectations are as it's related to data sharing and the requirements there to update that. Did that answer your question?
Yeah, that's great. So not only does it provide information on current data available, but what might be coming next.
Yes.
A preview of coming attractions. That's terrific. I can imagine that's very helpful to your stakeholders. I'm interested where the terminology first-class citizen came from. Were you around for that?
No, I wasn't, but it's a great analogy, right? Like that's really how we need to look at data as a first-class citizen, because it should be.
Very good. I think at this point, do you have any other final thoughts that you'd like to share?
I don't, but if people have other questions, I'm definitely ready for those.
Great. We had a reaction from New Mexico. Thank you, Katherine. I found your presentation efforts amazing. I love that it is simple, that you have a data asset inventory dashboard along with some other documentation. So just wanted to share that, call it out, make sure everyone saw it. I think now it may be the time to bring back our other panelists. I will remind everyone that this is open season on questions. Please share them through the chat. And I have a few more that I'd be happy to share, and we'll do so now. Jen, I'll call on you first. In your presentation, you mentioned the approach to data quality assurance or quality control, and I wonder if you might say a little bit more about what's involved in that, because we all understand the importance of putting accurate data, especially in the public domain.
Yeah, I guess there's a couple of different directions I could take that. In relation to this presentation, it was related to the dashboards that the teams were looking at. And actually, Katherine, we have been doing a lot of actually what you were talking about, trying to ensure that all dashboards are clear in what each field is on that, what the definition of that field is, where the data is coming from, because across the board, we're pulling from different data sources, and there has been confusion in some cases, what's what. So we've actually cataloged everything in Axon, which is data catalog, but it's helping the teams to start asking the right questions and really challenging what's in the dashboards and not just taking it at face value. So I don't think it's a simple question, but it's helping to teach the teams to dig in. I mean, really those 5 whys is really important. You know, when we look at data in there, we can't just take it at face value. We need to ask those questions and understand what those numbers are and what they're saying. Just because something's good doesn't mean we shouldn't question it. We would question bad numbers, so we should also question the good numbers and understand that. But it's really, you know, I think first, because of the varying levels of experience, it's really helping just go through the iterations of seeing how people ask these questions and how they look at this data, because without that data integrity, you know, our reports mean nothing, or we're making incorrect assumptions based on what that data is telling us. So I'm not sure that that's a real clear answer. I don't think it's an easy one to answer. It's a little different for every organization.
No, that's terrific. Thank you. I don't know, Monica, Leanne, Katherine, if you have thoughts on that aspect of what we do. Okay. For Monica and Leanne, one of the user categories that you identified in your presentation were data redistributors or data resellers. Could you say a little bit more about the use cases that those types of users would be interested in, and maybe what sort of things are allowed or perhaps not?
Sure. I think this also maybe is related to data quality check. So the reseller or redistributor was a user category that wasn't based on an organization type. It's specifically on a use case. So the use case for those types was someone who's taking the data and doing some analysis or some kind of linkage or combination with another data set and then selling or redistributing in a public manner the results of that, so that output. And so thinking about quality and going and providing that to your user and then going forward from there. The specific use cases, it was only 3 states that specified that. So I think most states, from my understanding, maybe aren't having that user type, but that would be, the purpose would be to compile into a data set that is then being distributed or sold at a third party.
And I'll just add to that, like a specific example, a lot of the APCD data is obviously used to evaluate costs and cost transparency work. There may be an app developer who is trying to develop an app for a particular state or collection of states that would request the data from those states and then use that in their app.
Great, that's a very helpful example. Thank you. Review of outputs. What types of things are the APCDs typically looking for before outputs are released, publicly published, become part of a presentation in your experience or your review of those states?
Yeah, predominantly that was related to security concerns or identification, the identifiable of patient information. Some states also had restrictions on identifying providers as well. So they may have separate, also be looking at both provider and patient identifiability. So looking at just broadly whether that was a concern, and then also looking at cell suppression when that might pop up. And then some states also just reviewed if they have, stricter legislation that needs to be considered. That was also part of that review process.
Excellent, thank you. Katherine, I know you mentioned that right now you've developed these very comprehensive internal facing processes. Is there follow-up from your office or your team on the contents of the analyses that are generated using the data, or because it's internal and to support policy decisions and things like that, that's a little bit less of a concern for things that aren't going out in the public domain?
So I'm gonna say that's a little bit less of a concern for us at this point. Yeah, it's a little less of a concern for us at this point.
Great. All right, thank you.
Jonathan, do you mind me hopping in?
No, please. No, please do.
Okay. I was just going to say, I did note, and I think this is something that's interesting, is that some states in that review of outputs stated, we're not looking for validity of methods. We're not looking for accuracy of this researcher's work. It really is, from what I was seeing, more related to security. And so states may include language in the data use agreement or policies about this is what will be reviewed in your output. And when you cite your data source as the state APCD, you must acknowledge that we are not responsible for how you're using the data in that citation. So that is something that some states are doing, I think, to mitigate any liability there.
Right, disclaimer language and that kind of thing. Thank you for bringing that up. That's an important issue and something important to consider in developing data governance policies and processes. Katherine, one more question about the process leading up to the wonderful work that's been done in North Carolina. How did you choose the 5 pillars? Is this related to HIPAA, state requirements, combination?
So this was before me. But yes, it's a combination of HIPAA, a combination of state requirements and government policies and legislation.
Great, thank you for that clarification.
No
and folks,
problem.
Please share any feedback or comments in the chat. Open question to all of you. What do you view as the sort of remaining challenges? Many states and HSRI's review of 14 or so state APCDs. What are some of the remaining challenges? What are people still struggling with?
I think for us, one of the things that we really want to bring our focus to when it comes to the data request and data sharing process is that data destruction, right? I think sometimes people have the tendency to do good things with data and then they want to use it for different uses after the fact. And so kind of reeling that in and putting some focus and attention there is one of our challenges and something that we're kind of focusing on.
Katherine, thank you for bringing up that important issue. I think what I really appreciate about some of the strong data governance procedures is that it is for a specific use case that goes through a pretty thorough review, and not just opening it up more broadly, and that each use case should be reviewed. I mean, I think that also relates to your question more broadly, Jonathan, is that as we have more state APCDs, and also others that say they have national APCDs, there is more concerns about data use, and the protection of individuals and providers. I think I think we should remain vigilant in those data use cases and ensure that there are strong governance processes so that individuals, providers, patients will be protected, as we want to take advantage of these data. And right, it only takes one data governance process to kind of go a little sideways, then it really calls into question how states feel about sharing these data. As we mentioned earlier, some states won't share anything other than de-identified, but we've also seen the real value of being able to have some more limited data sets. And I don't want to lose that value by not having adherence to data governance processes, so we can continue to really get the benefit from these data sets.
Excellent, thank you. Donald Poe reminds us that a new use requires a DUA revision in the state of Arkansas. I think that's pretty common across state data use agreements, that a data use agreement covers the approved uses as described in the original application, and any new uses require some sort of an amendment process. A question for HSRI. What payer types, commercial, Medicaid, Medicare, are typically included in state APCD data sharing efforts in your experience?
Thank you. I think it really varies by state. There was at least the example where I mentioned where there's an internal use for only the state agency and all other users have a separate category. That state also restricted it to only commercial claims. And in general, I think there's a difference also between Medicare, how Medicare and Medicare Advantage are shared, and that may result in how the state collects that information. But broadly, there's variation there.
Yep.
Yeah, and some of that depends, to Monica's point, on how the state, for example, in the Medicare case, how the state access through which program they're accessing Medicare data. We've seen an example that, it has to be like included and integrated with the broader APCD, and some that it's a very like strictly restricted data set where there needs to be like special permission to access the Medicare data as part of the broader APCD. I would say the same as in Medicaid. I think there are a number of states who have APCDs, and part of the reason for having the APCDs is a strong connection with the Medicaid program, and that those data are made available alongside the commercial data, but there is variation.
Excellent points, and maybe a topic for a future set of presentations and a panel discussion. We are just about at time. I would like to thank all of our presenters, Katherine, Monica, Leanne, and Jen, for their very thoughtful presentations and responses to our questions today. Thank you so much, and to anybody in the back office who helped you put these materials together. I know it was a team effort in a couple of cases. Thank you to Norm and Charles and the entire NADA staff for putting on a wonderful virtual conference. These get better and more interesting every year, and we know that's going to continue. Look forward to seeing you all at the in-person conference early next year. Thanks everyone for joining, for your thoughtful questions and feedback, and hope you all have a great day and rest of the conference.